All right, and there we go. We should be on this slide, or
do I need to start over?
Since I am recording it, we can just go ahead and start over.
Okay, sorry guys.
It's all good.
All right, guess we'll start all over. All right, so for scams for 2021 and how to protect yourself. So I'm going to be talking about ways that the scammers are contacting people. So scammers are contacting beneficiaries by internet, social media, text and telephone, mail and print, and in person. These are the ways that the scammers have been contacting everybody. So the internet, the scammers are actually sending, scam emails, fraudulent websites, and social media posts. So social media, that includes like Facebook, Twitter, anything like that, Instagram, any of those platforms that they are using. They're contacting people by sending them, messages. They can actually call people through Facebook. So people need to be wary of what the information they're putting on their social media pages. Don't answer a lot of those, questions that you've seen those where they can actually give out, personal information, especially like your mother's maiden name. Don't answer those questions, because a lot of those, question and answer things are a lot of your security codes. So if you get those things on Facebook about, answering, the questions about your past or whatever, don't answer those. Because they're giving out a lot of your personal information, a lot of your security codes. Go on. So text and telephone, scammers, this is the biggest way that they were using, especially during, the lockdown. They were sending fraudulent text with the link for you to, put in personal information. Telephone, you got all these robocalls, fake telemarketers. So a lot of the scammers are, they're either trying to, get your Medicare number, get your Social Security number, get any type of personal information. A lot of the contact tracers are calling people, telling they've been, in contact with someone that has COVID-19. A lot of the contact tracers, the true legitimates, are not asking for personal information. For example, Medicare numbers and Social Security numbers. So keep that in mind. The true workers are not asking for those personal types of information. So you have to be wary of anything. Yeah, go ahead. So you have to be suspicious of anything, telemarketers, anything, and they're out there doing genetic tests, braces, anything like that. Anything dealing with the COVID-19, there's all sorts of scams going on. Go ahead. So mail and print, you can't, there's a lot of beneficiaries receive a lot of mail, especially during open enrollment or right before open enrollment. So they just need to make sure that all, that's all legitimate. Don't respond to anything that they think might not be legitimate. So flyers, scammers can be posting flyers for a number to call, posters, newspaper advertisements. You never really know who's putting those advertisements in. So be leery of anything that check it out before you do anything. Next. In person, always be suspicious of anyone coming to your home, especially if you haven't, the uninvited, the unsolicited door-to-door contact. So if you haven't invited them, just be very leery. Don't give out your personal information, things like that. There's a lot of people going door to door, selling stuff, anything like that. So just be leery of anything like that. So the current scams for 2021 that I've been dealing with, you've got all the COVID-19 scams, and I'll be going over several of those. The Medicare brace scam, the Social Security scam, and the IRS scam. That's the ones that I've been dealing with here lately. So, of course, there's all types of fraud right now going on with COVID-19. So, and consumers and, patients need to be just vigilant in protecting themselves. Keep going. So, the OIG warns that fraudsters are targeting Medicare beneficiaries through telemarketing, social media, in-person, door-to-door, anything and everything, text messages, phone calls, anything and any way they can get a hold of the beneficiaries. I mean, the scammers are even faxing the doctor's offices of beneficiaries, trying to get the doctor to sign off, for, mask and things like that. Next. So what does actually Medicare cover in relation to COVID-19? Medicare does cover the test if they're ordered by your doctor or healthcare provider. Medicare covers all necessary, hospitalizations and things like that. Of course, Part A, you do have your copays and things like that. Go back. It's going too fast. Medicare does actually cover the COVID-19 vaccine. And also Medicare will also cover any telehealth services, like if beneficiaries, doesn't want to get out and go to the doctor. A lot of Medicare is actually paying for a lot of the telehealth, but they need to make sure that it's the actual doctor and things like that, send them that stuff. Go ahead. So the COVID vaccine, there should be no co-payments, no co-insurance, and no deductible. Medicare is pretty much covering it all the way around. Now may be some type of administrative cost sometimes, where the doctor, gives you this and they charge an administrative fee or something like that. But, all that should be billed to Medicare's. So types of Medicare fraud related to COVID-19, I said there's the treatments, there's the supplies, and then there's the other medical supplies. Go ahead. So contact tracing, 5 things you need to know. Real contact tracers will not ask for money or, personal information. They don't require your bank account or credit card information. Do not click on any links in a text or email. You might have downloaded, malware, so you have to be careful with that. Your immigration status doesn't matter for contact tracing, so real tracers will not ask. Contact tracers won't ask for your Social Security number, so just keep that in mind. They also won't ask for your Medicare number either, because a contact tracer is just someone letting you know that you've been in contact with someone that has COVID-19. Some treatments, you got your medical care, you got your cures, and you got your vaccines. So medical care, there could be billing issues. Make sure if someone's in the hospital, if they have to go in the hospital, that they get an itemized statement to make sure that, they're not getting charged for any services that they did not receive. Make sure, the diagnosis that is correct, and any transportation related to COVID-19. Make sure, that's all been billed correctly. Okay. Cures, right now there is not a cure for COVID-19. So anything related to a cure for COVID-19 is a scam. So there is not a cure currently available. So if there's anything out there on social media, internet, anything boasting a cure for COVID-19, it's a scam. Okay. I said scammers are actually using false advertising for cures and things like that. So be wary of anything like that. If you all come across anything like that, please let me know, because the Office of Inspector General is going after this COVID-19, any scam related to it, hot and heavy. So just be aware of. So if you see anything, please let me know and get it to me as fast as possible. Vaccines, as you know, they have started giving vaccines out. So if you get a call regarding vaccines, usually the health departments are requiring people to go online and sign up or call a number to sign up. They're giving you, then they'll call you back with a date and time to show up or whatever. That's how here in Putnam County that they're doing it. So if you're getting a call from anybody saying that, one, they can get you vaccine by, mailing it to you, get you in front of the line, or, where you have to, pay to get in front of the line or pay to get your, vaccine, that's all a scam. So please, please, be wary of anything like that. Next. So yeah, here's the vaccine. I do actually have it, like SMP does have a scam watch out, the COVID-19 scam. And we've got these infographics. So if you all need any of those, are actually on the SMP Resource Center. You can just type in COVID-19 and it comes up with all these infographics and stuff like that. So need to be on the lookout. You do not need to pay anything out of pocket to get your vaccine, so keep that in mind. You cannot pay to be put your name on the list. It doesn't cost anything to get on the list. No one from Medicare or the health department will contact you asking for personal information. I should repeat that. Now, the health department did, for example, if you do go on, sign up, the health department will call you and let you know what day and time to show up for your vaccine, but they will not be asking for personal information right then and there. Beware of providers offering other products, treatments, or medicines for prevention of the virus. No one from a vaccine distribution site or healthcare payer will call and ask you for your Medicare number, Social Security number, banking information, anything like that. So just keep that in mind. They will not be asking for private information. Supplies, I said, watch out for. I've had a couple doctors send me the faxes that they received from the scammers, where the scammers have sent them a fax requesting a doctor signature for N95 mask, any of the personal protective equipment, hand sanitizer. You got to be careful where it's coming from. Some of it's not approved. So you just got to be careful where you're getting stuff, supplies. N95 mask, a lot of the AAADs, we have those, we can give to people. A lot of doctors' offices are handing them out, things like that. So you don't, necessarily have to have a prescription for an N95 mask. Okay. Yeah, some of the common scams is that, there's been lesser products substituted for the real N95 mask, and ineffective PPE being sold to, unwary customers where it's not even approved, where it's lesser products, lesser approved products, I should say. So just got to be careful where you get your stuff, especially if you've ordered it online or anything like that. So just be wary of that. Hand sanitizer, be cautious of making or purchasing homemade hand sanitizer disinfectants. Make sure you follow the current CDC guidelines for hand washing and proper use of sanitizers. So keep that in mind. There is a lot of people, selling the hand sanitizers at extraordinary prices and things like that. So watch out for the price gouging and stuff like that. So if you see anything like that, please let me know so we can get it reported. Some other, medical services that beneficiaries need to be aware of: telemedicine. Make sure that it's, the doctor is actually the one you're talking to. Sometimes you can call your doctor's office, do it online or things like that. Make sure it's a legitimate link and things like that. Home health care, make sure that they're, doing what they're supposed to, coming to the home, protective gear and everything. Hospice care, any diagnostic testing. People just need to make sure that they're reading their Medicare summary notices and compare them with their bills, to make sure that they're not, they're getting charged, that Medicare's getting charged for what they actually received. Prescription drugs, make sure that the pills are correct number of pills. We just here recently, we just had one, I think in the Middle Tennessee area, of the Walgreens employee that was giving other people's opiate medications. So Just keep that in mind. It happens all the time. So if you hear of anything like that, please let me know. Go ahead. So telemedicine, it's of course a critical resource during the pandemic. A lot of people's use telemedicine. Some examples of fraud, misrepresentation of credentials, and make sure it's the doctor, it's your true doctor. If it's your primary care physician, if you went to them for years, then they should know your information. Make sure medical identity theft, billings for services not rendered. So if you get your Medicare summary notice for a telemedicine and it never happened, they can't charge Medicare for that if it never happened. Offering other unnecessary tests or products such as back braces, anything like that. So be wary of those also. Be wary of any unsolicited offers of telemedicine services. You get a strange phone call from someone you haven't had any contact with ever before. Definitely be leery of that. And especially be vigilant of any offers of like pain cream, braces, genetic testing, anything unrelated to, what you're going to your doctor for. Keep going. So ways to protect yourself from telehealth fraud. Be sure to call your provider to schedule your telehealth appointment. If you receive a phone call from someone offering you free testing, it's a scam, hang up. Guard your Medicare card. Normally, if they're a telehealth, your doctor already has your information, so they shouldn't be asking for that. That sort of thing. Review your Medicare summary notice and your explanation of benefits to make sure you're not getting Medicare, your insurance hasn't been improperly billed for anything or items that you didn't order or anything like that. Write down all your telehealth appointments in your, personal healthcare journals. So keep those, handy. I just had a beneficiary from Memphis the other day called me wanting to more personal healthcare journals. So I'm going to be sending those out to her. So if you all need any, and actually, we've actually redid the personal healthcare journal. So I'll be getting the new shipment in here pretty soon, sometime in February. So they've changed it a little bit. So I'll show you what the new ones is next time. Home health, be suspicious of any unsolicited offers for home health. Take time to verify that, the company, the services and everything, certification for the individuals providing the home. Make sure you do your homework. Especially if you're on an Advantage plan, make sure that company takes the Advantage plan and things like that so that it can be covered. Make sure it's needed. Hospice, of course, hospice is a valuable health benefit that, it's really helpful during the end of life. Just make sure that everybody's, someone's not being put on hospice that really doesn't need to be. So watch out for, unscrupulous providers, where I had one, doctor was referring several people to hospice, even though they weren't hospice quality, or they were only referring them to this one certain company. So just be leery of stuff like that. Some examples of hospice fraud is, falsely certifying providing services to beneficiaries who are not terminally ill, billing for a higher level of care than was needed or provided, billing for services not received, or paying kickbacks for hospice referrals. So diagnosis tests, you just have to be wary of these. Scammers are offering, COVID-19 tests. They're offering, genetic tests. They're offering all sorts of things. So you have to be leery of the unsolicited phone calls and things like that, especially for diagnostic tests when they're not necessary. Keep going. Prescription drugs. I said there's some seniors have reported official sounding calls from Medicare stating that due to their prescription history, they qualify for COVID-19 kits, supplies, or other additional medical services. So if there's anything dealing with your prescriptions, you need to work directly with your physician and the pharmacy. And that's people that you call that who you're actually calling. Don't deal with any of the unsolicited phone calls and things like that. Just hang up on them. So here's some tips to avoid COVID-19 fraud. Be cautious of any unsolicited requests for anything, personal information, Medicare number, anything like that. Be suspicious of unsolicited offers of COVID-19 tests, treatments, or supplies. Be suspicious of any calls, coming to your door, email, social media, anything like that. So be suspicious of all of it. Only a physician or other qualified healthcare provider should recommend or approve requests for COVID-19 testing. So keep that in mind. Of course, a lot of the county health departments do have the drive-through testing. So just go to one of those. Those are free. Keep going. Of course, here's the SMP National, the Scam Watch for the COVID-19 or the coronavirus. There is, we've got our resource center. So if you need any of that information to post in like senior centers or anything like that, hand out to your, housing people, please, go. You're more than welcome to go on to the SMP Resource Center and sign up, get your own ID and password, and I will approve your account, and then you can have access to all of this information, flyers, anything and everything. So please use these. We have tons of resources that we get from Medicare. There's tons on there. ACL is putting out something new almost every day, and our resource center is also. And then other states are actually contributing to the SMP Resource Center also. So you can find a wealth of information, presentations, anything and everything. So please use that if you haven't already. Go ahead. So the brace scam, I don't think this thing is ever going to go away. It's been going on for several years now, and it is still going on. It's not as bad as what it was, but it's still happening. Beneficiaries are still receiving boxes of braces that they didn't order, the doctor haven't ordered. They don't even know who the name of the doctor is when they get their Medicare summary notices. Faxes, be wary of any faxes that your doctor's office receives for signatures for braces. And of course, if any of the calls, beneficiaries are inundated with these calls from claiming to be from Medicare or asking about their pain, and that Medicare will get them free or low-cost braces. So be wary of any of all of that. The Social Security scam, this is going on. They get, they're calling beneficiaries, or not just beneficiaries, but anybody, because I just had a friend call and received a call not this morning. That her Social Security number has been used fraudulently, and that there's a warrant out for her arrest or something like that, and to press this one number or whatever to talk to the investigator or whatever. It's a scam. They're either trying to get your information or trying to get money out of you. So these actually need to be reported to the Social Security Administration Office of Inspector General. You can actually do it online, or if you don't want to do it online, there's a toll-free number you can call, and it's 1-800-269-0271. So that's the number for the Social Security Administration Office of Inspector General. That's where those type of calls, anything dealing with Social Security, that's where they need to be reported. So the IRS scam, with it being tax season, so beneficiaries need to be vigilant of, who they're talking to. IRS doesn't normally call people. IRS only, usually does anything by phone. So, scammers are calling people claiming to be the IRS and they owe back taxes, and that in order for them not to come arrest them, that they need money or green dot cards or, Amazon gift cards, Google. I mean, it depends on, it's amazing what they can come up with, Bitcoin, whatever. But usually it's not the IRS calling. They only usually communicate by mail. One good thing, make sure that, if you're filing taxes, file them as early as you can, so that, someone else is not filing using your identity. Things like that. So just be vigilant of those. And these actually need to be reported to the IRS. IRS has their own Office Inspector General. And those need to be reported to phishing. That's with the PH. ISHING at irs.gov. They may have a phone number you can call, but I couldn't find it. And what the information that they're needing, is they're looking for, what number showed up on your caller ID, the telephone number you instructed to call back, maybe a brief description of the communication. What did they say? Name of the employee if they gave you a name, badge number if they gave you a badge number, the exact date and time that you received the call, and anything, geographic location, time zone where you received the call if possible. So they're wanting as much specific information as they can get. And but keep in mind the phone number, it may not go anywhere because most of the time they're using fraudulent phone numbers, because they can change the phone number that pops up on your caller ID to be anything that they want it to be. So, but still, they want those, because you never know, they might be able to trace those. Keep going. So how do you protect yourself from Medicare fraud and abuse? Treat your Medicare card like it's a credit card. Watch out for identity theft. Do be aware that Medicare doesn't call people or visit to sell anything. Keep that in mind. Don't give out your Medicare number to, the unsolicited phone calls, unsolicited door-to-door salesmen, anything like that. Don't give out your Medicare number. Only give them to your physicians or your providers that you know. Don't carry your Medicare card unless you have to have it. It's just good. That way, if your purse gets stolen or something, they don't have to have your Medicare number. The one good thing about the Medicare numbers, of course, if you have been a victim of the scams and you did give them your Medicare number, you can call 1-800-Medicare and request a new number. And you would have to actually call Medicare and actually request a new number. Tell them that you don't need a new card, you need a new number, because you've been a victim of a scam and that you gave out your Medicare number. Now, if you lost your Medicare card, you can actually call 1-800-Medicare and request a new one, or actually you can go onto your mymedicare.gov account and get your card that way. You can actually print one out. So that's two ways to get your Medicare card if you've lost it. Now, if you've given out your Medicare card fraudulently, you can request a new number. Okay. So some of the tips for protecting yourself, of course, be alert that scams exist. Scammers are out there everywhere trying to get your information. Know who you're dealing with. You can't trust any, and I hate to say this, but you cannot pretty much trust anything you see online, the unsolicited phone calls, anything like that. You cannot trust anything nowadays. So do your homework first before you click on any links or anything like that. Be wary of any unsolicited phone calls. I keep getting the one about, my car warranty. My car warranty has been out for years. So be suspicious of any of those. Do not open any suspicious text messages, pop-up windows, or anything like that, because there's a lot of malware and things like that that could be associated to emails. Anything like that. Don't respond to phone calls about your computer asking for remote access. Definitely hang up on those. Keep your personal details secure. Don't give out your Medicare number, Social Security numbers, anything like that. Don't even confirm them. If you even get phone calls, wanting to confirm your information, just hang up. Keep going. Keep your mobile devices and computers secure. If you don't have a virus scam software, definitely get that. Get the software. Protect your Wi-Fi. Don't have it open. Have it password protected. Anything like that. I'll have it all password protected. Don't use, computer at Starbucks or something like that, or have it, online, and don't use your banking information and stuff like that in an unsecure Wi-Fi. people can get a hold of it that way. So just be vigilant. Choose your passwords carefully and change your password often. Just review your privacy and security settings on your social media. Change them, beef them up if you have to. Things like that. Change your passwords if you need to. Hackers are even getting in Facebook, creating new profiles for people. So you just got to be wary of those also. Be aware of any requests for any details or money. If you get these unsolicited phone calls requesting money or anything like that, just hang up. It's a scam. Be wary of any unusual payment requests. So scammers will usually ask for preloaded debit cards, gift cards, iTunes cards, anything like that. So if you get something like that, it's a scammer. Just hang up. Okay. I do actually have a Tennessee Facebook page. If you haven't went and liked my Facebook page, please do. I actually put on there usually some type of scam that's going around or any news, anything like that. So I put a lot of stuff on my Facebook page. So it's real helpful information. All my scam alerts and stuff like that go on my Facebook page, anything like that. So please go and like my Facebook page. Okay. Of course, if you all have any questions or anything, need to report fraud, abuse, billing issues, scams, anything like that, please, don't hesitate to email me, call me. Y'all, most of y'all have my contact information. If not, here it is on this slide. My toll-free number rings directly into my office. Here in my office number, they both ring into my office. You can fax it to me. You can email it to me. Mail it to me, snail mail, that's fine. Of course, snail mail right now is slower than a snail, but it'll still get here eventually. But if you all have any questions, please don't hesitate to call me or anything like that. Okay, do y'all have any questions? I know I had some. Okay, let me go through here because a bunch of questions were popping up while I was I think someone asked if I was supplying the PowerPoint. Yes, Olenka, can you send that out to everyone?
Yes, I definitely will.
Okay. So yes, you all will be getting the PowerPoint. Let's see here. Okay, it is free to the consumer. If you have insurance, they will cover it. Uninsured can also get it free through the health departments. Yes, so if you're going through the health departments, it's free. Okay. Yeah, insurance or no insurance, you can get the vaccine at the health departments for free. Yes, that is true.
Lori brought up a good point about getting calls from people saying that you called them first. That's also happened to me. And it's come from a phone number that's like similar to mine, and they're like, "You just called me." But
yeah, the scammers are very creative. They'll say, "Well, hey, we're returning your call," and a lot of insurance agents will do that also. Hey, we're returning your call, or something like that. Just still hang up. If you know you did not call these people, just hang up. And make sure if you're going online filling out in anything, especially if requesting more information from Advantage plans or anything like that, if you fill out anything online, they are going to call you because you have filled out something online. You requested more information online, so they will call you. And yes, scammers are spoofing local phone numbers, so that they're hoping that since it's a local phone number that pops up, that you're more likely to answer it. I even tell beneficiaries, even if it's a local number, if you do not recognize it, do not answer the phone. because scammers are spoofing local phone numbers.
Hey, Lonnie, this is Lori. Another thing that I had happen was that I got a phone call from an unknown number. So I didn't, it had like a local number, but I didn't answer it. And I had just gotten a new phone. So I didn't answer it, figured they'd leave me a voicemail or not, and it'd be a scam. But then I turn around a couple of seconds later and I get a text message from the same person for the same phone number. And I'm like,
wow,
okay, maybe it's somebody that was on my friends list that didn't make it to my phone.
Yeah,
and it was just like a, hey, what's up kind of message. Like, so it seemed familiar. And then when I responded to it, they said they were from a local church and they were trying to increase their basically their footprint in the neighborhood. And I was like, no, thank you. And I'm blocking your number now.
Yeah, really. Yeah, I said you can't trust anything nowadays. You can't trust the internet, text messages, phone calls. I mean, it's just sad how this has become. You cannot trust anything nowadays.
That's true. Hey, and on another question, so when you go into the hospital and they give you that estimate that what your like out of pocket should be,
yeah,
I mean, is there anything to do if it's like really astronomically wrong? Because when you get your EOB, I mean, it's like maybe $40 or $50 that you should have paid, but then the hospital gives, and it looks like a bill. I mean, that they give you that day.
I tell beneficiaries, do not pay out of pocket up front until they build your insurance.
Well, I mean, I paid a little bit that day, but fortunately it was just about the same amount that my EOB said I should have paid.
Yeah.
So I got lucky, but what if someone went in and paid the full amount? I mean, would they
just have to go back and request a refund? I mean, and they've got proof. If you could actually have a copy of that, beneficiaries, please, get copies of everything. Anything you sign, get a copy of. Anything that, any advanced beneficiary notice of non-coverage, get a copy of that. Anything that you sign, if they give you estimates, get a copy of that. And that way, you can go back and, request your money back.
Okay.
Nancy has her hand up. Nancy, what you got?
Can you hear me?
Yes.
Okay, real life situation. Back in 2019, I had some surgery. After my surgery, I get a bill from the hospital where I had the surgery for over $2,000.
Ooh.
Yeah, I'm like, wait a minute. I looked at the data service, which I recognized the data service. It was the date of my pre-op evaluation. I'm like, and I'm on a Medicare Advantage plan. I'm like, okay, I've been around long enough. I don't owe this bill. I knew I didn't owe the bill. So I called them, explained, oh, no, ma'am, you owe it, you owe it, you owe it. I said, well, until I get my explanation of benefits from my health plan, I am not paying you. So it goes on, and of course, those bills are delayed because you're looking a month to 2 months out from the time till you get the explanation benefits.
Yeah, exactly.
And over the next 2 or 3 months, I kept getting the bills. I finally called my health plan and said, are you showing? I told her what I had, and of course, they maybe saw the data service because it was my pre-op, but she said, no, we're not seeing anything like that here. I said, fine. So again, I called them and said, my health plan doesn't have it. I'm not paying. But it took about 3 to 4 months before I knew it was wrong. I've been down the road many times. I knew it was wrong. So I tell people, do not pay a bill until you compare it to your explanation of benefits, whether it's the Medicare summary notice for Medicare, the explanation of benefits from your health plan.
Thank you, Nancy.
because they make, and they were, no, ma'am, this is right, this is right. And I wanted to say, well, here's where your problem is. Again, I've been too closely related to the claims sometimes. But again, that's not my job. I just said, well, until I get it from the health plan, which I knew I wouldn't be, I cannot pay you. I just held my ground. They finally got it fixed. But again, this is 3 or 4 months down the road. It might even been more than that. I don't remember. So compare your statements, your bills from your doctor's office to your Medicare summary notices or your health plan explanation of benefits before you pay it. And then look, either the you may be billed or here's your copay column.
Yeah, exactly.
And many more than that.
Exactly. Thank you, Nancy.
You're welcome.
Some other ones that's popped up on the chat. Nancy's been getting emails about her Chewy purchase that she didn't make. There's also, I've heard about the Amazon one too, where you're getting emails or text messages about your Amazon purchase. So just be leery of those. And then Adrian put in, she's gotten another scam. A so-called investor is calling to see if she wants to sell her house. They've called and texted numerous times. Oh, goodness. Well, haven't heard that one about wanting to sell your house. Adrian, are you going to be moving?
Not anytime soon, but yeah, it's crazy. They call and they'll say something like, others in your area have been selling their house and they've told us that you'd be, and I'm like, that's not true. I don't know my neighbors. Or they'll text and want to know if I want an evaluation. And I'm like, no, I'm good. And that's when I find I'm like, you're not a real estate agent. If I want it to sell, I know how to go and get a real estate agent. But so that's another one that I've heard. Kind of going back to what Nancy was saying, I had a question. Now, I've had a couple of people, because of the time delay, and, of course, we encouraged them to get a mymedicare.gov account so they could see their stuff quicker. But even so, they're being intimidated because they're worried about their credit rating or going to collections. And so I told them to write on their bill and send it back to their provider. I am waiting for my Medicare summary notice, or call them and tell them that they're not going to do anything until they get that notice. But I think those strong arm tactics are pushing them to make payments.
They don't need to, because, even if they send them to the collection agency, I can deal with the collection agencies. I deal with them all the time. And I would just call the collection agency and they can put it on hold and say they're not going to pay this until they get their Medicare summary notice or their explanation of benefits in the mail. Most of the time we can actually call Medicare and get the Medicare summary notice faster. We don't, like if we're needing it immediately, they can send that. We can just ask them for that specific one, that specific service. And then they can mail that one just to the beneficiary faster. So we don't have to wait, that quarter or whatever for it to get here.
Okay, good to know. Thanks.
And that's another good thing about the mymedicare.gov account. They can actually go in and see their claims in real time. Yeah, Nancy, that's why you and I are thinking alike, Nancy. That's kind of scary. Because Nancy just posted they can see their claims online if they're on original Medicare. And sometimes if you're on the Advantage plans, the Advantage plans actually have where you can go in and see your claims too. If you have an Advantage plan, you have to have an account through the Advantage plan.
I had a question.
Sure.
On Facebook, it keeps coming up. You can get more money from Medicare, $143 or something like that comes up all the time. Press this button and go for. I don't, people are asking me about that, and I don't.
Yeah, that sounds like there's other agencies out there that help people sign up for the Medicare savings programs. That's that one, $48.50 that they're talking about, that Part B premium. That I would be leery of those. because you never know. Some of those, I said, be leery of any links or anything like that. You know, if someone is needing assistance with paying their Part B premium, they need to contact SHIP. That way, you know, SHIP does the non-biased Medicare counseling. They can help people sign up for those type of programs, and they can actually, SHIPs can actually screen them to see if they qualify for those. So I would definitely be leery of any links like that on the internet.
Thank you.
Any other questions?
I just wanted to be sure that I got recorded my PJ. I signed in as a guest, and it's the only way I could get signed in.
Is that Patsy?
Patsy Gooden, yes.
Okay, okay. I'll put your name down.
I got you down.
Thank you.
Okay. Christine, did you have a question?
I just wanted to add something. It's not just about the, and I said SMPs instead of MSPs. It's not just about the MSPs. What they're talking about when people are calling in is they've seen there are some situations where there are Medicare Advantage plans that will basically give a kickback to people who sign up for their Medicare Advantage plans. I really haven't encountered any in our region, but in some regions, they'll basically kick back some of that Part B premium if you sign up with their plan.
Okay.
So you don't have to be eligible.
Yeah, if beneficiaries are signing up for an Advantage plan, they need to be very leery. They need to do their homework first, make sure that all of their providers, and I'm talking all of their providers, take that plan before they ever sign up. I've even had beneficiaries receive those calls, and they've told them no, yet that plan still signed them up without their permission. I've had several of those. I've been in contact with the Kirkland Cancer Center in Jackson, where they've had several of their members signed up for Advantage plans without their permission, or the Advantage plan told them that yes, that they were, you know, a provider for Kirkland when they were not. So we've had several of those. Just so keep in mind, if you all come in contact with any beneficiaries who've been signed up for an Advantage plan without their permission, or the Advantage plan lied to them to get them to sign up, please let me know so that we can get them reported, and either I can get them switched back to the original plan that they were on, or switch to a different plan. Okay, Patsy, do you still have a question? Or
Well, I already asked the question.
Okay. I guess the next is Linda or John. Do you have a question?
Yeah. Linda, yeah, when we signed in, we also signed in as guests. So I'm not sure why it came up as guest, but it just
y'all are still showing up, Linda and John Johnson.
Yeah.
You're good.
Yeah.
We got you.
Okay, thank you.
Okay, any other questions? Adrian says, I think I got one plan in the Mid-South region pays $40 toward the Part B premium, but it doesn't include drugs. Yeah. Oh, goodness. Okay.
Could I ask you one other thing?
Sure.
The other day, the doctor wanted the $203, or well, he took $200 up front. Did I do wrong to give him my credit card up front?
Yeah, I would highly recommend not doing that. Tell them to bill your insurance first, and then you will pay anything that, you know, your insurance tells you to, unless they're going to a provider that does not accept Medicare. So if you know you're going to a provider that does not accept Medicare, of course, you will have to pay up front.
Well, he had this form that I filled out, and it said it's between you and your insurer and all that. And I wrote on there that I understood that he took Medicare. I wrote that, in my own writing, and then I signed it.
Okay, that sounds like you signed an advance beneficiary notice of non-coverage.
No, I was a new patient, and so they were telling you about their billing practices, and they always say that it's between you and your insurer, like, they can bill you anything and you'll have to pay. And so I always write on there that I understand that you accept Medicare, and I never have had a problem yet, but I guess I could.
Do they bill your insurance, or do you have to
Yeah,
send it?
they will bill my insurance.
Oh, okay.
But I always feel uncomfortable about that.
Yeah. You have to make sure that they're a participating provider. Make sure that they take Medicare assignment. And you can actually check that on the Medicare.gov. You can actually check to see if they actually take assignment. They may take Medicare, but they may not take Medicare assignment. And that's two totally different things.
But if they take Medicare assignment, then they will not charge you anything, right? But if
they shouldn't, because then they have a contract with Medicare if they take Medicare assignment.
Right. But if they don't, then they can only charge you a certain amount.
Yes, over what Medicare would pay. I think it's 15% over what Medicare would pay.
Okay, so
if they do not take assignment.
So they could charge me 15%.
Yeah, more than that, 20%.
20%?
Well, you got Medicare only pays 80%, then you got that 20%. And then if they do not take assignment, they can actually charge 15% more on top of that.
Okay.
To the best of my knowledge.
Okay.
But if they do take Medicare assignments, then they can only accept, the 20%, and then, or not the 80% of what Medicare has agreed to pay.
Well, I just think I'd be severely limited as to my doctors if I expect them to take assignment.
Okay.
Yeah, so, I mean.
But you can check to see if your doctor takes assignment. You can go to the Medicare.gov and check.
Yeah, I've done that, but they have very few doctors that take assignment.
Oh, okay.
Yeah. Okay, thank you.
You're welcome.
Keep in mind, $203 is now the Part B deductible.
Mm-hmm.
This is February, so a lot of people have not met their deductible. And also, even if you have a supplemental plan, starting as of the first of last year, that Part B deductible is no longer picked up by your supplemental plan. My sneaking suspicion is that's where the $203 came from. That physician's office has no way of knowing where you stand in your Part B deductible, if you've met any charges in the month of January. And if not, then you're going to owe the full thing. If you did meet some in January, you're still going to owe the 20% of the approved charge, which again is, we don't know what that is. It depends on how all the claims and those codes go through. But I think that's why you're getting the $203, especially early in the year. They know more than likely that people have not met their deductible. And so they're wanting to make sure they get something. And especially knowing that even if you've got a supplemental plan, it's probably not going to pick up the Part B deductible.
Thank you, Nancy.
You're welcome.
Yeah, for some reason the 203 didn't ring a bell with me until you just mentioned the deductible. I'm like, oh yeah, that's what that is. Yeah, most likely it's probably your deductible.
Yeah, it was my deductible. She told me she called my insurance.
Okay. Definitely have to pay your deductible first. Can't get around that. There's no way getting around that unless you have like the old Medicare policies.
Well, the other thing is that this is the second doctor I've seen this year, so I'm wondering you know, why didn't the first doctor get my deductible?
Because they probably didn't file yet.
Or maybe they were playing by the rules. I don't
know.
Keep good records.
Could be, yes, definitely
And
keep
check your Medicare summary notice when it comes in. And if it doesn't say in that you may be billed column, if you're on original Medicare, that 203, you get a hold of that provider's office and say, look, I paid you in good faith, and now it says I only owe you $20 or whatever it says.
Yeah,
right.
Exactly.
Get your money back.
Get your receipts. If you pay anything, make sure you keep your receipts. Make sure you keep your bills, anything and everything. Make sure you keep those.
And Lonnie was talking earlier about the journal. I actually, and I've been doing this for years too, I set myself up, what was actually in some Microsoft stuff I had, but it's an Excel spreadsheet and that I print off, and every time I get a healthcare service, I put the date, who I saw, where it was, a little about why I was seeing them, and then I put information about deductible, copayment, and whether or not I paid it. If I paid it by credit card, I put a note out there of what credit card I put it on. That just helps me later when I get those explanations of benefits in, or I get a bill. Now, what is this? Did I pay this? I can go back and look at my log, and I know where it is. Plus, at tax time, I can just go down that list and add up those amounts, and I know how much I've spent on my medical care for the year.
Yeah, that's a good idea.
Thank you. I didn't even think about doing that.
That's a good idea. Very good idea, Nancy.
Yeah.
Well, again, this is no, I can't remember what the name of the Microsoft program was. It's long gone, but I can actually send a copy of the thing they have if you want. I'd be glad to share that because again, it just helps me keep track. When my husband was alive, he had multiple medical problems, and I was forever trying to keep track of what doctor did he see, what did we pay, what do we owe, where, when, and why. And it just made it easy to put on there and go back and look. I put my dental visits on there. Now, when did I go in and get my teeth cleaned? I've got it on there. I also put on when I get my prescription, because again, then at the end of the year, I compare that. I go back, I take the time and I compare that to my receipts. But then I know I'm good to go. These numbers are solid. I pretty much know, again, what I've spent and what I've spent on.
Right.
And it's worked out well.
Nancy, I think that would be really helpful. If you wanted to send it to me, I can send it out. Yeah.
I'll bring it up and send it to you.
Any other questions?
All right, if we don't have any other questions, we can go ahead and end this webinar for today. I want to thank everyone for attending, and Lonnie, thank you so much for presenting. You did an excellent job. And just last minute, if anyone hasn't typed their name in the chat box, if you're not able to, or if you're able to, please make sure to just type your first and last name in the chat box. That way I can make sure my attendance is correct. And you should be receiving an email within 24 hours with a YouTube link. I'll include Nancy's document that she's going to share and the presentation that we had today. So yeah, everyone have a great rest of the day, and you guys are free to go.
Thank you all for listening.
Bye. Thanks, Lonnie.
I don't see a chat box.
It's all good, Patsy. I got you written down.
Okay.
Thank you, Marcus. Have a good day, Adrian. Are y'all ice covered yet?
I would think so over there. I'm up in Rutherford County, and it's just rainy. Nothing.
Oh, really?
No ice.
It's rainy here too. Okay.